All right, so getting to look at the last type of edema, we've spoken about edema, where we said that one is just accumulation of what fluid in the interstitial space, right? So this one now is brain edema, and from the word, you can get to see that what this one there's accumulation of fluid in the brain. All right. So talking about accumulation of fluid in the brain is actually something that is sensitive. It's a crazy case, right? So we'll get to look at it and look at the definition, look at the types. We'll look at the possible things that could cause fluid to accumulate in the brain. We'll look at the symptoms, we'll look at the diagnosis, then we'll look at the possible treatment that could be given if there's accumulation of fluid in the brain. There are possible complications that could also what follow suit. All right. So for the definition, we say that brain edema is also known as what cerebral edema. All right. So sometimes some lecturers will say cerebral edema. It still means the same thing. Okay. It's a potential life threatening condition characterized by excessive accumulation of fluid in the brain. Now, looking at this image, can you see that this image has a lot of whitish stuff here? Has a lot of whitish stuff here. That shows that there's fluid. There's fluid accumulation, right? Types now. It could be vasogenic edema, and this one is as a result of what? Disruption of the blood-brain barrier. Okay, so now if the blood-brain barrier is now disrupted, fluid will now leak into the brain tissue. All right. It could be cytotoxic edema, all right, where there's cellular swelling due to what injuries or toxins, right? Then it could be interstitial edema, where there's fluid accumulation in the brain tissue in the interstitial. Okay, then it could be hydrocephalic edema, where there's accumulation of fluid because the CSF or the cerebrospinal fluid, the free flow of it has been impeded. All right. So looking at the possible causes, these ones are the types, right? So possible causes of brain edema could be traumatic brain injuries or stroke or cerebral ischemia. It could be brain tumors. It could be infections like meningitis, encephalitis. It could be toxins. It could be hypoxia or hypercapnia. It could be diabetes mellitus, right? So all these seven types are the possible causes of brain edema. Okay. So looking at the symptoms now, if there's accumulation of what fluid in the brain, of course, the patient will complain of what headache. And even the patient not tell you this one, the family members will tell you. All right. So they'll tell you that the patient has been confused or have been having some altered mental status, right? There'll be nausea and vomiting, seizures, there'll be weakness, paralysis, vision changes like diplopia, they are seeing double double, there'll be blood vision, there will be papilledema. All right. Then diagnosis, if you want to confirm that it's a brain edema, you need to do things like CT scan. That's why we have all these images. All these images are CT scans. All right. Then MRI scan could also work. Lumbar puncture could work. Electroencephalogram could work. Transcranial Doppler ultrasonography could also work. Treatment. The patient could be complaining of difficulty in breathing. So make sure to give them oxygen. They'll be complaining about dehydration, give them fluids, osmotic therapy, corticosteroids, and diuretics just to reduce the fluid levels of the body. Diuretics that could work include furosemide. Surgical intervention like craniotomy, CSF drainage, then you also monitor them if there's increased cranial pressure or if the vital signs are kind of like switching up or so. Do you understand? Complications. It is accumulation of fluid in the brain. What could it result to? It could lead to increase intracranial pressure, could lead to herniation, could lead to brainstem compression, could lead to respiratory failure, could lead to what? cardiac arrest. Okay, so on that's our definition or our discussion on brain edema, also known as cerebral edema.